Welcome to Project Echo, Eating Disorders series. This session is titled Understanding Eating Disorders, Frameworks and Lived Experience. I'd like to begin by acknowledging the traditional owners and custodians of the unceded lands and waterways. We recognise their diversity, resilience and ongoing place for First Nations people hold in our communities. I am today coming to you from Wadawurrung lands, and we pay our respects to elders both past and present, and commit to working together in the spirit of mutual understanding, respect and reconciliation. We support self-determination for First Nations peoples and organisations. Welcome to our Eating Disorders Echo series. We are excited to launch this new series that has been designed to enhance your understanding and management of eating disorders through a collaborative case-based learning approach. Throughout the series, you will have the opportunity to engage with experts in the field, discuss real-world cases and gain valuable insights into the latest evidence-based practices. Our goal is to empower you with the knowledge and skills needed to provide comprehensive care for individuals and their loved ones affected by eating disorders. Okay, into housekeeping. We love to hear from you. So in the chat, could you please put your name, your role and your region? Turn on your video during the discussion, but remain on mute except when you're speaking. The chat can be used to ask questions or make comments or even respond to other participants. The raise your hand function or simply signal come off mute to ask a question. Please think about a case for our next session and fill out the case template that we drop into chat later. It's really important that we hear from you guys with cases and that to help learn from each other. These sessions will be recorded. The didactic presentation only will be disseminated on our learning channel. The discussions will be de-identified for quality improvement, so please let us know if you would not like your comments recorded. All right, learning outcomes. Discuss an overview of the National Eating Disorder Strategy and the Victorian Eating Disorder Strategy. Identify key components and standards for an effective and equitable system of care for eating disorders. Describe actions required to coordinate care for individuals at risk of or experiencing eating disorders, including support for their families and communities. Participate in a community of learning and practice. Who's on today's agenda? I'm your facilitator for today and for the whole series. My name's Naomi White, Senior Manager of Regional Partnerships and Public Health at Western Victoria Primary Health Network, and very happy to be with you all. Our didactic presentation today is by Sarah Trobe from the National Eating Disorders Collaboration National Director Clinical Psychologist. We'll also have a presentation today from Stacey Gray, who's sharing her lived experience as a carer for someone with an eating disorder. We also have a panel for discussion. We'll have a panel every week, and this week we have Michelle Ryan, who's a senior dietitian at Grampians Health, and Anna Ximena Torres, strategy and policy lead at the National Eating Disorders Collaboration, and Dr. Kate Graham, who's a GP and clinical editor of HealthPathways and our COVID clinical advisor at Western Victoria Primary Health Network. And on the tech duties today and always, the star of the show, Jemma from Western Victoria Primary Health Network. Now, I won't go into the biographies of our presenters today. I'll let them introduce themselves. We've got a very jam-packed session today, so we're hoping very much to keep to time. So I'll go straight over to Sarah Trobe from the National Eating Disorders Collaboration and the National Director and Clinical Psychologist. Welcome, Sarah. Over to you.
Thank you. Good morning, everyone. Lovely to be with you on this fresh morning. You can really feel the change in the seasons. Thanks for this opportunity. NEDSC, we're really excited to be presenting at a number of these sessions over the coming months. Wonderful collaboration, and we really thank Western Victoria PHN for organising this. We know that there's a real a swell of interest because the prevalence of eating disorders is going up. So it's just a really great opportunity to bring so many professionals together from different services, professional backgrounds, to be really thinking about collaborative care and the service system in Victoria. I'll tell you a little bit more about NEDC in a moment, but I would like to acknowledge the traditional owners also. I live, work, and mostly play on the lands of the Wurundjeri people of the Kulin Nation. Like to pay my deepest respects to their elders past and present, and note that this land was never ceded. I would also like to acknowledge people with lived experience, lived and living experience, including carers and families of those who are experiencing an eating disorder. The insights that you bring to this work is absolutely fundamental to everything we do. And it's really wonderful that we have lived experience representation here today. And I'll actually be talking about my own lived experience as a carer in a few weeks when we talk about one of the particular diagnostic presentations. But really, in healthcare, that we can only do better when we're listening to those with lived experience. So whilst I wish that no one had to experience an eating disorder, we just really, really value and thank you for bringing your expertise into the work. I might just grab that one else. For those of you who are not familiar with NEDC, we're funded by the Federal Government Department of Health and Aged Care. We've been around for about 15 years. And we are funded to build the system of care. And you're going to hear that language a lot over this ECHO series. It's a really important framework for us to use to think about what our role is in the system of care, but also importantly, referral pathways and other ways that we're using the system to support a person who is experiencing an eating disorder and their families and support them thinking about a whole of community response. So we have, over the 15 years, evolved in terms of what has been needed in the system of care. And we came and developed a national strategy in the end 18 months ago, and that's what we're going to be talking about today as the most important thing that we're doing to build the system of care, because it provides us a roadmap for what we actually need to do. Because we think of, oh gosh, eating disorders, there are so many things we can do. And what that's really helped us to do is identify the priority actions. So we build the system of care, and a really important part of that is to bring the sector together. So that is creating partnerships and relationships across the whole of the country so that we're sharing resources, sharing expertise and reducing duplication. As we know, there's more than enough work to do, and we have so many wonderful people doing excellent things that those relationships and learning from each other is a really important component. All of our work is underpinned by those three pillars of lived experience, clinical expertise and academic expertise, and we don't do anything without ensuring that that's really present and identified in all of our work. So as was mentioned in the learning outcomes, I'll give you an overview of the national strategy and the recently launched Victorian eating disorder strategy. Now, some of you might think, oh, do I need to learn about a strategy? Government's going to do that. What's it got to do with me? It's actually got everything to do with us. And I want to give you some important updates as to, why this is really important for us as health professionals to support us to do what we need to do. And that, as I mentioned, that step system of care framework, which will be really, really helpful also. We're going to be using that step system of care throughout the sessions, but if you're really eager at the end of this session, there will be some resources and tools that you might want to get started on or access because of the different place that you might be in your learning journey. In terms of the step system of care, there is a more structured word-based format of this, which we will send around. More than happy to do that. But I want you to always remember when we're talking about a system of care, we're thinking about a person who is at risk of an eating disorder or is experiencing an eating disorder, and the different touch points that they might have on any part of our community system. So that's engaging with our friends and family. It is accessing, sports and other interests and occupations. It's interacting with our school system. It's accessing our health system, treatment system, and everything that really wraps around a person in a holistic way. So everyone in community really does have a role in eating disorders. That can be through prevention, the way that we talk about food and bodies and how we talk about diets and all those sorts of things. We can have a role in identifying warning signs in ourselves or in someone that we love, a friend or a family member. And then as health professionals, then we take on that more clinical role of being able to actually engage with someone who's in front of us, who may not be talking to us about an eating disorder, but there's some red flags. And so it's our ability to have a conversation with them, complete our assessment, really understand what that person needs in terms of treatment, supporting them to access the right type of treatment. And treatment can look really, really different. And we're going to talk about that as well. And then also thinking about, if someone's engaged in treatment, what else needs to be really put in place to support them? Their friends and family, how we're supporting them. Can this person still go to work or go to school? Could we organise peer support? So there's other things outside of the clinical intervention, I guess, that we need to be thinking about. As GPs or practice nurses or dietitians, mental health professionals, we really have a strong role, an important role across the components of the system of care. And so through this series, it's going to be really helpful for us to identify those parts that we might be able to strengthen up or bolster in terms of your knowledge and skill, and take actions away for you to be able to improve your response to eating disorders. So it's this framework that underpins the National Eating Disorders Strategy, because it's telling us, saying, well, what needs to happen for prevention to happen really well in our community? What needs to happen for eating disorders to be identified in every setting? So regardless of the person who is experiencing it and who they're talking to, everyone feels equipped to identify those warning signs and high-risk groups. That we have every health professional who has a role in providing an assessment and referral has the skills to do that. We have a fully equipped treatment service system of self-paced, lighter touch, intensive options, and that we have a really robust psychosocial and recovery support system. And so whilst we love a linear journey, we know that people's journey through eating disorders doesn't necessarily go in a straight line, but that we have a system that can respond in a really flexible way depending on the needs of that person, and that they're culturally informed and trauma-informed, so that person has access to a system that really meets their whole of person needs. So where did the national strategy come from? So the sector actually said, NEDC, we think you need this. Why that is because there are many people across Australia doing really great things, but people were mostly working in silo or kind of making decisions around, we think that this is probably the best way to build a system of care, or these are the most important ways forward, which we've made great progress over the last 20 years, and particularly in some states. And I will say Victoria is doing really, really well, because there have been some really good organisations and infrastructure put in place. But to have a consistent step system of care across Australia, so it doesn't matter where you live, that you can access what you need across that journey, is going to be really important. And to give service leaders, clinicians guidance on what needs to happen first and then what needs to happen after that. And it also helps governments. So it helps all of the state and territory governments and the federal government to say, that's what we're trying to achieve. So it's easier to fund things because we know that this is a consistent way of building the system. So we're 18 months down the track and we're making really good progress in terms of activating all of those stakeholders that need to be involved in implementing the national strategy. And this one is slightly different in that it is sector-led. So NEDC is funded to oversee the implementation of the national strategy, which is different to the Victorian strategy, which is being led by the government and many other national strategies that we see around the place. So we're here to support stakeholders such as all of yourselves, so to support health professionals and leaders, governments, to be able to implement the national strategy. And we provide resources, we're evaluating it and provide guidance. So this is a welcome and a relationship building activity as well, that if there is something that's happening in your local service that NEDC could be of assistance with, please use these ECHO opportunities to connect with us. As I mentioned, the step system of care underpins the national strategy. So there are 141 actions that are split across these components of the system of care. So, for example, under prevention, there might be, I'm making up a number, but there might be 15 actions that need to happen. Under identification, there's 16, etc. Now, how it's actually organised and why not all 141 actions are the responsibility of one person. So NEDC isn't responsible for all of the actions. I'm just going to cross that one out. Is that all of the actions have actually been allocated to a stakeholder. So some of the actions are the responsibility of primary health networks. So it's really wonderful that, Western Vic PHN are actually, this is an example of implementing the national strategy, is supporting their workforce. Some are for lived experience organisations, some are for mental health services and clinicians, researchers. There are some in there for GPs and other medical professionals. And that's around, can you identify, respond and provide medical management for people experiencing eating disorders? So if we had I think there's 34,000 GPs in Australia feeling really confident and equipped, can you imagine what that first response is like for a person experiencing an eating disorder to receive what they need at that point of care, and the clear referral pathways that a GP is able to really support them on? And of course, there are some actions related to government, and we're working closely with the governments across Australia to help them to fund those certain areas. So when we think about the actions, and as I said, we'll talk about this over the next few months, there are some around upskilling yourself. If you're a clinician in the room saying, yeah, actually, I've been doing this for many, many years, you might actually be thinking of, how could I support other GPs or other nurses in my practice, other dietitians, in terms of peer supervision, sharing learning opportunities. Is there something happening in your practice that could strengthen? So you might be the only clinician in your practice who sees eating disorders. Is there something that you could be thinking about around triage and referral pathways within your service? Is there something about communications? So are there flyers around that we could be helping people so that the people in the community who are sitting in your practice are also saying, there are services available. And you might also have a seat at the table around policy or in the PHN, around government. So there are lots of shared roles, I guess, that we can hold, and that you can play different roles in building the system of care. In terms of the Victorian Eating Disorder Strategy, this was launched just over 12 months after our national strategy, and we were heavily involved in the development of the Victorian strategy. So they're perfectly aligned. What the Victorian strategy does then is take the national strategy and say, how does this actually apply to our Victorian context? How does it actually fit in with existing strategies, the mental health in schools program, the Victorian wellbeing strategy? So that's what the perfect application of a national strategy to a local context is. It has also come with some money already. So there was money announced earlier last year for some particular eating disorder programs. And so that's the start of the implementation of the Victorian strategy. This was only launched late last year, so they're in the initial stages of pulling together an implementation, committee to oversee that. But just for some, early, shifts in the Victorian system, that they're trialling some community intensive programs, one being in Barwon. I think the other one was in Alfred. The first Victorian residential facility will be opening in the Alfred region. So that's a statewide residential facility. That will be opening in March. There are going to be 10 early intervention and integration leads spread out across the state. So there will be one in your region, and their role is to support that early intervention. So they will have a bit more of a phone call role so that people can contact them and get access to, where do I get treatment from, and that early assessment. Eating Disorders Victoria, you'll hear about more over the few months. They've got a number of different programs, including peer support, telehealth nursing, family support. So Eating Disorders Victoria have received funding for the continuation and expansion of their programs. And they're a really important referral pathway for you to know about, particularly if there are long wait times that you can't get into a service. Contacting Eating Disorders Victoria is a really good first point because they can provide short period counselling that can really hold that person and hold the family during that time. The other really important organisation is the Centre of Excellence in Eating Disorders, or CEED. They've been around for a long time and they provide training and case consultation and do a lot of work around the service building. So they've been working in, to build the capacity of Ballarat CAMS for a very long time, Bendigo CAMS. So they've been working in the CAMS setting for about 20 years so that CAMS can provide a response to young people with restricting eating disorders. So you can see that there are shifts happening. Why it's important? is because that means that they're going to be different people that you can have contact with, different people that you might be able to provide referral pathways to or get access or support from if you're struggling with a case yourselves. The framework, fairly similar to the step system of care. So you can see that prevention and identification, treatment and recovery support. So similar frameworks. So you don't have to feel that you have to go, I'm only following one or the other. They're actually really intertwined in terms of what they're trying to achieve. So why does this really matter to everyone in the room is that if we're all thinking about strategies and thinking about what our role can be in building this system of care, that means that this person's journey might be able to be more linear. That means that from the first time those warning signs are identified, because all of us in the room and people in the community know what those red flags are, and we can support someone to get to a health professional to provide a comprehensive assessment, provide some psychoeducation, and really understand how do I make the best referral for this person to a really robust treatment system. And as I just mentioned, there are things happening in Victoria now to make that system more robust. We know that there are long wait times. It is not a perfect system, but there are more options. And for us to understand what is the most appropriate treatment setting for someone in terms of a self-paced option or a community option, or we need something more intensive. And so when you know your local service system, you can feel more confident to say, okay, I know I've got somewhere to send this person. And also I'm going to make sure that their family are really well supported as well. So when we're all equipped, and I say we're as I'm a health professional as well, we're equipped to fulfill those roles, but also we're supporting those people that we work with and supporting the integration of those systems and working with our team members and interdisciplinary care team members, that's going to make that journey much more seamless for a person, which means the eating disorder doesn't go on for as long, doesn't become as severe, and doesn't have such a huge impact on the person and those people caring for them. If you're keen to get started or you want to know of a few more particular roles, we do have a web page for GPs, which is still really relevant for nurses. We've got a fact sheet that outlines the national strategy for dietitians and a separate one for mental health professionals. Hopefully I've captured everyone who's on the line today, but please reach out if I haven't. We've got free e-learning if you want to get started with equipping yourself. And as I mentioned, a couple of those resources and fact sheets. We'll continue to update you through these sessions as we find out more about service changes that are happening in Victoria. But if there are any particular questions, I think I'm staying online now to answer questions, or Anna will be able to at the end as well. I'm going to hand back over. I think I've ended just in time.